Hi, everyone. Good morning and welcome to the 8-part learning series of the Utah School Mental Health Collaborative. We are here at our final part for this 8-part series. So we're very excited that we've come this far, and also super grateful for all of you who are either attending or who are going back and watching this webinar as needed. So thank you all for your support and participation, and we can go ahead and get started. So we have our team here today from the Utah Lab that houses the Utah School Mental Health Collaborative, and we are a technology and training, education and consultation lab housed within the College of the Department of Educational Psychology. So first, we want to give a big shout out to organizations and institutions who have supported us through partnerships and funding. So some of this work would not have been possible without the support from all of these different organizations and institutions. So we have Cambia Health Solutions, we have Utah State University, we have Huntsman Mental Health Institute, and also ULEAD as a part of Utah State Board of Education. So the content for today's training was developed by the Mental Health Technology Transfer Center Network, we call MHTTC, and also the National Center for School Mental Health, we call NCSMH. And the MHTTC hosted an 8-part learning series, or a training series really, using the National School Mental Health Best Practices Implementation Guidance modules. And really this was targeted for states, districts, and schools who are interested in implementing or even learning about comprehensive school mental health. So MHTTC actually worked in partnership with the National Center for School Mental Health to put this resource together. And really it's to ultimately help states, districts, and schools advance their existing comprehensive school mental health systems, but also have them engage in a planning process for the implementation work. So the primary intended audience for this series includes districts, school teams, community behavioral health providers, and really like anyone who helped develop and oversee school mental health systems, let it be system-wide work, class-wide work, building, school-wide work. So all of those varieties. So here on the screen, you see kind of two manuals. To the left, you see a trainer manual in orange, and to the right, you see a participant manual. So these are what we call the guidance. So these manuals contain the guidance modules, and each of these contain a set of 8 slide decks, and really those 8 slide decks reflect the 8 different components of the curriculum or the implementation guidance modules. And each of those represent kind of the core features that are helpful to develop comprehensive school mental health systems. So if you are interested in accessing this modules or these resources, these are freely available on the MHTTC website. If you have a hard time finding them, you can register on the link to this current module that you're watching or the current webinar, and then we can let you know how to get access to those resources through the MHTTC website. Okay. So here you can see the kind of the 8 different modules that make up the implementation guide. And we have covered all of these up until module 7, and today we'll cover module 8. So if you haven't had a chance to join all of our webinars, that's totally fine. We have recorded these, and you can find them on the Utah School Mental Health Collaborative website. So if at any point you are currently implementing one of these, or hope to or plan to implement one or some or all of these for the next academic or school year, feel free to go back and check out these webinars. And if there are any questions, I have my contact information on the final slide, which I will show to you at the end of the presentation. So feel free to get in touch with me. I'll be happy to help and support. So today we'll kind of recap IMPACT, which is the last module of comprehensive school mental health systems. And of course, as usual, we'll talk about some best practices when we are hoping to implement them. Okay. So before we get started, a really quick disclaimer. All of the opinions expressed in this learning series or this learning session today are the views of the presenters, and they do not reflect the official position of the Department of Health and Human Services or SAMHSA or the MSCTC network or the National Center for School Mental Health. So there is no official support or endorsement, sorry, from any of these organizations. So the opinions expressed in this document is intended or should be inferred. So let's switching gears, let's take a few minutes. So I'm just going to share some highlights from this module as a refresher. But I do want to remind you that the full module recording is available on the MSCTC website. Again, if you have trouble accessing it, please reach out to me and I can direct you that way. Okay. So in this module, we will review the definition of impact and kind of talk about the values of documenting and sharing information about the impact of comprehensive school mental health systems. We'll also quickly review some quality indicators, and then we'll talk about some real challenges that schools will experience when trying to measure and report impact. So to start off, I'd like to always start off with definition. So let's take a minute to see what we mean by impact in schools and comprehensive school mental health work. Okay, so really impact kind of refers to the long-term effects or the changes or really the impacts that occur or that happen when, you know, certain programs, practices, or policies are implemented within a comprehensive school mental health system. So think about the outcomes that you see as a result of implementing XYZ programs or policies in school mental health work. So we have the definition, but why do we have to document it? Why do we have to report? So this is kind of like a two-part thing. We want to document impact, but then we also want to report impact. And why do we have to do both of these or even either one of these? So documenting the impact of comprehensive school mental health systems really help like a district or a school to kind of describe what's going on and what are some areas that they have succeeded or what has gone well, but also what are some things that need more improvement. So what the impact data does is it provides information, and think of it like as a quality control mechanism if you want to further your comprehensive school mental health work. So for example, if the implementation of Tier 2 school mental health services results in improved educational functioning for your students, but then you have staff who report increased burden, then this might, so you have a positive that things have gone well, but then you also find this like area of need where your staff are burned out. So this kind of makes you think that, okay, we definitely want to continue Tier 2 mental health services because it's increased educational functioning of students, but then how do we help teachers lessen their burden? So this could be like thinking about the paperwork that teachers have to do, maybe increasing staff support, so things like that. So you want to know what has worked and what hasn't worked, so that you can like work to better your system. So that's kind of like why you want to document, but why do you have to report impact? Of course, a lot of the work that that schools do kind of revolve around funding or policies or decision making. So really, if you have this this data documented, you can share it with your policymakers, you can share it with your funders to kind of demonstrate the value of and the cost effectiveness of a comprehensive school mental health system. So when you do document, what kinds of things do you want to document? Of course, there's several things that you can, and this is kind of a very brief list. So I'll kind of give you a minute to skim through this slide. So once you do document, of course, it's good if you can document over time, right? And when you do document over time, all of this data do impact certain aspects of your school functioning, and that includes educational outcomes. So think about students' grades, their testing scores, and even your staff's retention rate. Think about health, so improved health and well-being of students, your staff members, and also the social, emotional, and behavioral health aspects. Think about school climate. As a result of documenting and reporting impact data, your school climate and safety can be improved. Relationships between staff and students, school violence, student safety can be improved. And also ultimately, we spoke about funding in the previous slide. Having this data handy and being able to record it can also help you save costs, kind of see where you as a school or district are spending excess, and what kinds of things or areas could you decrease your expenditures. So could be certain services or tangible items, and how could you reallocate funds to improve other areas such as dropouts or suspension. So so some things to definitely think about. And in the next slide, we'll kind of go through a district example of how this district really was able to use kind of like an existing student information system, which I will talk about, to start collecting more information on students who just received tier 2 and tier 3 services, like mental health supports. All right. So we spoke about documenting, and this is one of the benefits of documenting. So this school kind of used their, student information system is called Power School. And this is a system that a lot of schools here in Utah also use. So what they did was they tracked their data um, for students who are receiving tier 2 and tier 3 mental health services and supports, and kind of identified with the different, like, so for example, they found out that students who do receive these services are students with high levels of disciplinary action, suspensions, chronic absences, poverty. And then after 1 year of providing these services, what they found out was that certain number of students, a certain percentage of students who were receiving those services no longer required tier 2 language arts supports, and a certain percentage no longer require tier 2 math support. So the benefit of documenting this is you know where to stop, you know where to start. You also know how many students you serve. And by tracking this kind of helps you monitor and also maintain the services you're providing, but also identify who no longer needs those supports. So you can take in more students who are currently at a risk level and need those supports, and like have the other students kind of transition more into back into kind of like the whole school, the whole classroom level. Okay. So how do you document and how do you report? So I spoke about PowerSchool in the slide before. So schools have these different data tracking systems or student information systems that you can use to track student progress and track students who are receiving services in these different domains. You can also use best practices to document outcomes, disaggregate your data, and report to stakeholders, which we'll kind of elaborate more in the coming slides. Okay. So I spoke about student information systems, so we call SIS for short. So these are kind of like electronic information systems that really help to not only organize, but also manage different kinds of student data that the school wants to collect or hopes to collect. And typically these student information systems, they house data that, you know, staff manually enter and then are kind of consolidated by this system. So it kind of creates like a more efficient process than having to like store and record, like not record, but store kind of like the paper versions of data. So you have like, so you have kind of different systems. The sophistication kind of varies depending on kind of the budget of the school, what school admin or staff want, but it could really range from a simple Excel file to kind of like a more complex web-based, you know, system that helps gather, analyze, and report data. So, so just this slide just like kind of goes to say you don't have to have like a complex system. It could also be a really well organized, continuously maintained Excel file as well. Okay. So let's kind of talk about documenting. So I know this is like a two-part. Previously it was a two-part topic, so documenting and reporting. So let's talk about documenting tier 2 and tier 3 service students who receive tier 2 and tier 3 service support. So kind of how do you document, right? So first you want to, of course, define. You want to define your tier 2 and tier 3 service support. So this is kind of where you work with your team to come up with definitions of how you want. First, you have to operationally define what you're measuring, right? So kind of coming up with your team and clarifying which service and supports kind of fit the tier 2 tier 2 level, and then same thing for kind of tier 3. And you know, this really, the definitions really depend school to school, district to district. So there's no right or wrong answer. It's just like what works best for kind of your group. So after you do define, you want to clarify how students are identified. So how are we going to clarify how students fit into this definition? So you want to develop almost like a systematic process or kind of like set of steps. Again, this is something your staff will work together on, and you'll use this to identify which students kind of fall into or within these definitions, or students who are identified for tier 2 and tier 3 service supports. So some of these, you know, after you do define and after you do clarify, so some ways that you could identify students who need services through these different tiers. You know, you can use school referrals, you can, you know, use school-wide screening. So it really depends on how your school works or how your district works. And of course, once you have defined and clarified, you want to find a good student information system. Again, like I mentioned before, it doesn't have to be sophisticated or fancy, really something that works for your school. And this is really important because either way, whatever system you select, it's really important that it is organized, well-defined, and also easy to maintain. So again, think about feasibility. customization, all of those like different features. And then you want to decide who is reporting, what they're reporting on, and when they are reporting. So ideally, any school-based team member, it can be a school employed personnel, a school-based community personnel. So whoever is providing kind of the tier 2 and tier 3 service supports could be a person who reports. And then you can decide to start with kind of specific services or specific students served, specific grades. So there's no like one way to do it when you start reporting. It really depends on like what works best for your school and kind of like what your target is. So if it's like maintaining certain things or like asking for more funding. So again, this kind of goes to say there's no right or wrong way to do it, but just like kind of doing it systematically and also working with your team. Okay. So here is kind of like a list of quality indicators for the impact domain. And we kind of like touched on this in the previous slide. So in the previous slide, we kind of like spoke about, you know, how do you document? And then I also want to focus on kind of like the best practices. So when you do document, you want to document the impact, right? Which is ultimately what this topic is about. So for example, if you do track students who are receiving tier 2, who are receiving services through tier 2 and tier 3 tiers, you want to document how these services have impacted their educational outcomes. You want to document how these services have impacted their social, emotional, and behavioral outcomes. And then once you have that data, you want to kind of disaggregate. So you want to kind of like almost categorize the data. Again, like I mentioned before, it could be according to grade, it could be according to race, to age, to gender. So really, however it works for your school and whatever the need is, you can kind of disaggregate your data. And then you can document and kind of broadly report the impact. So pretty much report the data of these services on these different kind of impact outcomes. So I'll talk more about that. So I spoke about educational, measuring the impact on educational outcomes. So a team really needs to decide kind of what specific educational data they will collect. So some examples include like, think about things that are easily accessible, right? It could be grades, it could be attendance, it could be performance on kind of like standardized test scores, achievement scores. But like I know, so trying to kind of target easily accessible data is helpful, but also kind of it's important to consider what educational data are kind of like of most importance to the different groups, like I described before. So kind of think about the different options like educational data that you could report on, but also kind of think about at the same time what's important for the different groups or the students or the families in your school, and also the policymakers and funders. So with that, another thing that I want to mention is you also want to select data that can be shared within the school and also beyond the school team. So something that you could easily disseminate and talk about when you go to report that data. And similarly, you kind of have the social, emotional, and behavioral data as well. So again, think about data that's easily accessible, readily available, can be reasonably collected. And those kind of include office referrals, suspensions and expulsions, behavior observations, crisis incidents, school climate data, and also teacher well-being data. So, but if for this and also for educational outcomes, you wanna pick data that you can share within and beyond your school team, and kind of like pick outcomes that are kind of important to the different groups in your schools. So some things to think about. Okay. So the next best practice is to what extent, so now that you, for example, have defined and identified your data, what are some best practices to disintegrate the student mental health services and support data to examine student outcomes based on subpopulation characteristics? So I'll give you a minute to skim through these best practice bullet points. Okay. So being able to kind of disaggregate the student mental health service and support data, what the benefit of doing that is it helps teams to kind of identify if there are differences in student outcomes based on kind of the subpopulation characteristics that we want. So what it does is like overall, when you do it, it's kind of like helps the team to better understand more intentionally whether the outcomes that they've gathered as a school kind of differ based on, for example, gender, for example, race, age, or intensity if needed. So reviewing current student information or data collected for these kind of different variables help you take kind of like a closer look of how the outcomes are kind of spread across the different subpopulations. So and then from kind of that representation, you can identify, or from that data, you can identify students or like the populations within your student body who are not represented. And that information kind of helps you develop a plan to look into those populations who have not been considered or who have been overlooked. So so these are kind of like some best practices that will help guide you on collecting data and developing strategies. But like all in all, you want to work as a team. This is a lot of work. It's a lot of organization and maintenance. So you want to work together if you want to make your process of disaggregating more efficient. So here we'll kind of talk about, so kind of gives you a snapshot of the different groups that you can disaggregate along. So you have gender, ethnicity, grade level, length of time in the district, the mental health needs, race, if there are students from ELL backgrounds, students who are again receiving different services from different tiers, academic performance. So you have that as your subpopulations. And then you have kind of these different outcomes, which you spoke about previously: educational, social, behavioral, emotional. So all of this we kind of did speak about before. So think about the different combinations as well. So a combination from potential groups and combinations from potential outcomes. So kind of gives you all the different options that you can look at in your school. Again, prioritizing given the needs is kind of like a good way to get started. So I know this is kind of, so today's presentation is going to be considerably short compared to the other webinars that we have done. This is our last best practice slide, but in the next slide, I'll kind of show you different examples of reporting impact data. So let's focus on this last best practice and then let's move on to the other slides. So this slide kind of talks about best practices to report the impact of comprehensive school mental health systems to a broad and diverse group of stakeholders. So again, think about reporting the impact data of your comprehensive school mental health system. Really what it will ultimately help you with is to generate buy-in and and support from all of the different stakeholders that your school interacts with. So policymakers, funders, including caregivers. So you want to develop reports. So think about when you do report, what are some of the ways to easily disseminate your data? What are some of the ways that make your data attractive or makes people want to read that? So all of this, like different bullet points here, talk about the various ways that you could create documents to disseminate your information. So reports and newsletters, you can host meetings, you can prepare like one-pagers that really briefly talks about all of the impact data. You can create elevator speeches that talk about the different student outcomes over the year. You can share those at conferences or meetings. Develop a social marketing campaign every single year to kind of showcase your data or your outcomes. You can use news media outlets. You can use social media, and also you can, display all of that information on your school or district's website. Okay. So here is kind of like an example of an infographic. And this kind of shows the impact of the entire school safety healthy students initiative nationwide. And then you here also have like the state grantees featured on this flyer. So when you do develop documents or flyers to showcase your data, you want to develop or you want to display those in a format that's easy to understand, that's accessible to a variety or like a wide area of stakeholders. So think about all the way from district admin to funders to parents to teachers and even students. So you kind of want to think about all those different people when you are creating this, because it needs to the information needs to be easily readable and accessible and understandable. So think about those little things such as using large font numbers, brief segments or sections of text, and also consider not making it all text. So think about including graphs, images, charts. All of those help to make it more attractive and readable. So this is another example of using a brief communication document where they have shared findings from a school mental health effort in one state. So this is in Ohio. So this infographic describes a class-based positive behavioral intervention, and it kind of talks about the students served. It talks about the outcomes of the intervention, and also kind of like includes information across several school districts. So again, think about shapes, colors, fonts, and all those things that kind of make this flyer attractive and people kind of want to read it as well. Okay, so this is our last slide for the webinar, and I kind of wanted to talk about almost like reflect. Documenting and reporting impact data is great, and we want to do that because we want to maintain existing services that are working well, but we also want to kind of improve things that are not going so well. So to improve, to maintain or to improve, we still need the support, but there are certain barriers that schools and districts experience when it comes to either collecting data or sharing data or doing both. So just wanted to kind of talk about those to show that, schools, not everything goes well. Various schools kind of do continue to experience barriers. So some of these things may look like not being able to share data across systems, lack of staffing capacity. I did mention that this work does take a team. So What if you don't have enough staff to make your team? What do you do? And then the lack of technological options or infrastructure. So I spoke about student information systems. So those are kind of the most sophisticated ones. But then if you want to kind of use a simple Excel file, that also takes time to organize and really make it so that it works for you, right? So that still takes time. It still takes skills. So so what do you do if you don't have that support and that infrastructure? And another one is lack of knowledge, training, or time to create data collection systems. So these are some like real problems that schools encounter. So what do you do? What do you do when you do experience these barriers? And something to think about is kind of see where you want to start. And this kind of is also similar to what I spoke about screening. You know, ideally we want to screen the whole school, but what if that's not within capacity for your school? Starting small is always a good place to start than not starting at all. So think about what is the smallest scale impact data documenting and reporting that you can do with what you have, and reaching out to community members, soliciting support, again, speaking with your school admin, school districts, to share your ideas and solicit support and funding. So I just wanted to throw these out there as the last slide, just to show that not everything goes 100% well and successful for all schools. And some schools experience different challenges than others, but how do we still persist and kind of continue this work? Okay, so I did mention this is a shorter presentation than those I presented before, but that kind of brings us to the end of module 8 and also the end of this 8-part learning series. It has been 8 months, so thank you to all of those who have attended all of these sessions, attended some of these sessions, or are going back and just accessing the recordings. So just want to give a big shout out to the UTech Lab, the Utah School Mental Health Collaborative, all our participants, and also our funders and partners. So none of this work would have been possible without you all. So we'll kind of conclude the series, and next year we'll come back with another list of resources for you all to access. So thanks for being here today.